of the biggest challenges we have in pediatric GI, especially those of us that deal with a lot of functional disorder or disorders of gut-brain interaction, is the challenge is that often the agenda of the parents is completely different from the child. The parents are usually very concerned about a serious disease being present, and they expect, actually sometimes demand, some test. I still have to find a child that comes in hoping to get some test. The child almost always prefer not to have any test. So in trying to give in and trying to relieve parental anxiety, sometimes we make things worse in the child because every test is somewhat painful, is scary and frightening, and it can cause all sorts of long-term consequences. So one of the things that we usually say is that parental anxiety and physician insecurity determine the extent of the workup. So, you need to be able to relieve parental anxiety, because if the parents is worried, if the parents are catastrophizers, are worried that the child has cancer or that has diverticulitis or has a pancreatitis, whatever, then the child will not get better. The child will perceive parental worries, and there are plenty of studies that show that that's the case. And so our challenge is to establish a good patient-physician relationship, having the parents trust us and explain things in a way they can understand, and maybe do a limited amount, very targeted amount of testing. I usually ask the parents, what are you worried about your child has? And maybe I do testing to relieve that worries. If they're worried about, gallbladder disease or gallstones, I'll maybe do an abdominal ultrasound. They're worried about H. pylori, I may do a stool study for stool antigen and so on. So you've got to relieve parental anxiety without causing more anxiety in the child, and that's the art of doing something but not doing too much.